Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. And I'm just going to get straight down to this one. The NHS is a monster. I've done a video recently about how badly I was treated there. And then I read this today, and I'm like, no. But yeah. When the NHS buys things, products, medications, whatever you like, it should do so, like any other business, based on efficacy, quality and price. If you're buying the same product and there's three suppliers all selling the same product, you go to the cheapest. Or if there's a product where one is slightly more expensive to buy but its efficacy is greater than the differential in price, you buy the more expensive item, because ultimately it's a saving. If it can cure the problem, get the patient out of the way, moving on to the next patient, the individual item may cost slightly more, but you're not getting the patient lingering longer, which has other costs. This is sensible. This is absolutely sensible. It's how business does it. But it's not how the NHS purchasers do it. No, they don't do their purchases based on economics or the efficacy of the medication or the good of the patient or anything like that. That's out the window. They base their purchasing on how gay are the suppliers. No, really. Let's look at this article. You'll be astounded. Right, this is the article. It's in Breitbart for this particular one, but actually it's in lots of papers, Mail, whatever. So it is around. It's a thing. I'm just using this particular one because I've got a very nice picture at the front of it, showing. Look, equality is priceless. But actually health is pricelesser, you know what I mean? Richer than rubies. So the whole bunch of gay and lesbian people there giving a particular salute that was very popular in Germany about 90 years ago, I see. Well, that sums it up really. Anyway, a major branch of Britain's socialised medical system has been revealed to be granting healthcare contracts based on scores determined by the far left LGBTQ plus charity Stonewall, rather than just the quality of the products or care. Yeah, because the quality of the products and the economics of the products are unimportant. It's important that it's gay companies. It's companies that employ gay people or that are gay friendly. So there we are. When you go into hospital and you die, because you didn't get the right medicine, just be thankful you died, because at least the wrong medicine was supplied by a gay person. Leaked documents from the Lewisham and Greenwich National Health Service, NHS Trust, in London have shown that contracts, some of which are worth millions of pounds, are being awarded to companies that fall in line with leftist ideology on sex and gender promoted by the controversial Stonewall charity. Stonewall works for, it used to be for gay rights, but then the gay people all got the rights. They got every right they were requested, the same rights as everyone else. So Stonewall didn't really have any more reason to continue, but they liked the money, so they went, let's work on something else. Transgender. We'll go for trans and that. So they stopped working for people who were who were perceived to have fewer rights because of their attraction, and started working for mentally ill people, more or less exclusively now. And they are a protection organisation. They go into organisations and say, give us money and we'll put a plaque on the wall saying that you're okay, otherwise we won't, and we'll ruin your reputation. It's organised crime, really, if you think about it. A protection racket. But they're there, they're working for the LGBTP community, because that's their next challenge, is to get that P onto the list. Anyway, a whistleblower from the Trust told the Telegraph the outcome of this is the NHS might accept a tender from a company offering inferior products or higher prices, but simply based because they're Stonewall members. In other words, we've had to pay Stonewall £100,000 to get that plaque on the wall, but we're going to make that up by charging you more to pay for our plaque. Screw the good of the patient, screw the good of the economy of the NHS. So long as we make money, that's fine. Let's mince off over here with public money. To put it another way, the NHS is willing to compromise on patient care to promote Stonewall. It is worth pointing out that these are very large and important contracts worth multiple millions of pounds over many, many years for winning companies. The whistleblower, who wished to remain anonymous, of course, because he wants to keep his life and job, expressed hope that the disclosure would force the NHS to return to putting people's health ahead of virtue signalling and political campaigning. Indeed, and this is one of the problems when you have socialised healthcare, it's socialised, it's left-wing. And they're always going to promote left-wing policies at every opportunity. Now, if you take the politics out of the NHS and just say, rather than pumping money into the NHS, you allow the people to have publicly funded insurance, then the people can go to any doctor, the people can go to any hospital, and the people will choose the good doctors and the good hospitals over the left-wing plague pits that are often the result of what happens in socialised healthcare, and we call them the NHS hospitals. Currently, a publicly funded service is pressuring private companies to give money to an extremist, far-left, misogynistic campaign group. This is it, because Stonewall now are actually anti-women. With their push, constant pushing of trans ideology, they're actually trying to cancel women. And public money, their public money is being taken out to promote this. Money that could be used otherwise to save lives, to help that cancer patient, to help that heart attack victim, to help that child sitting in a ward with leukemia. But no, we're giving it to a far left anti-woman group. How do you feel about that? How do you feel about that when your child's lying in a hospital, ill, possibly dying, and money that could be used to save that child is being pumped in to Stonewall? I hope you feel as angry about it as I do. The documents provided to the broadsheet showed that the NHS Trust gave prospective companies 35 questions from the Stonewall UK Workplace Equality Index on diversity and inclusion strategies, despite the Department of Health and Social Care ending its relationship with the far-left charity last year. The questionnaire includes questions such as, if a company has a transitioning policy for transgender employees, yeah, I'd transition them out the door and straight into a psychiatric unit. And if they have policies to ban discrimination, bullying and harassment based on sexual orientation or gender identity. Well, that's actually the law. We have a law called the Equality Act 2010. So yeah, that's covered. You don't need to be asking this question. It goes on to question if the company has signed up to Stonewall's Equality Index, basically saying if you haven't given Stonewall money, you don't get the contract. The whistleblower told the papers that it's possible that other NHS trusts are using the same questionnaire, as it appears to be a standard template. Stonewall has previously been shown to demand that companies refrain from using gendered words such as mother in order to meet the standards of their equality index. If you start taking the sex out of medical care, people die. And it's as simple as that. I'm a man. If I am given blood from a woman who's been pregnant, whether she's given birth or not, just simply that that woman has been pregnant and then donated blood. If I'm given her blood as a man, that could be lethal. And what Stonewall want is, oh, you're not to ask whether that blood is male or female. That's one example. That can kill people. Their policies are madness, and will kill people, and especially in any kind of medical setting. Stonewall needs to be banned as a hate organisation because it's completely misogynistic. The NHS should be banned from doing any purchasing other than based on cost, efficacy and patient care. And any purchasing manager or purchasing director for the NHS who does not comply should not only be fired, but should be banned from working in public service ever again. In response to criticism of the charity over its increasingly far-left stance on transgenderism and the nature of womanhood, some government departments and ministers have attempted to distance themselves from Stonewall. Earlier this month, one of the founders of the charity said that Stonewall had discredited the gay activist movement by taking up far left positions, such as declarations that there is no difference between male and female bodies. I've done a video on this. Defending the use of the LGBT questionnaire, a Guy's and St Thomas's NHS Foundation trust spokesman said, under national guidance, NHS Trusts are required to apply 10% social value weighting for tenders. 10% social value weighting. So you're considering misogynism is a social value. Wow. You need to lose your job right away. I mean, immediately, and then go and seek help. Because if you think misogynism is a social value, you are mental. The spokesman claimed that while these particular questions are not used in two other trusts it supports, he could not confirm if other branches across London were implementing the Stonewall questionnaire. Well, if he doesn't know, then he is not doing his job properly. And you see, there we go, back to that particular salute. And that's all that you need to know about Stonewall. I will finish and come up. So the NHS pouring money into left-wing anti-women groups at the cost of patient care. Will you be out clapping them? I won't. Heads need to roll. There needs to be a full investigation, and there needs to be rules put in place to ban this kind of thing. And I said in the piece there, Stonewall needs to be completely broken up and banned as a hate organisation. It hates women. It's misogynistic to hell. And why public funding is going into it, nobody knows. You wouldn't fund a terrorist organisation. Why would you fund this? Anyway, I shall round off here. If you like what you hear and see on the channel, please hit the subscribe button if you haven't already. Ring the bell for notifications of future output. Leave a like, leave a comment, and until next time, stay safe, stay well, avoid the NHS, and goodbye.